Good evening, everyone. This is Dr. Verdiales, like every Tuesday evening, 9 p.m. I am the Atlanta doctor with CNY Fertility and Restore Health. Um, I am actually at the beach right now, but I did not want to leave you guys hanging. So here we are again to discuss some, interesting subjects and go over your questions. Um, so I wanted to talk about the psychological challenges and the mental, spiritual challenges of a fertility journey. I think that is definitely not discussed enough, and the implications in repercussions of those emotional wounds, they have to be part of this journey because those emotional, um, mental, psychological wounds could be blocking your rainbow baby. So since I'm in a very interesting setting tonight, I am in a little tiny island called Vieques, part of Puerto Rico. I came to see my mom and celebrate her birthday, which is tomorrow. And so, as I'm here and I'm in this environment looking at nature and really thinking and just healing myself, I want that for all of you to be able to heal those wounds that could be holding you back, not only in your fertility journey, but also um, on your personal development journey as well. So, um, just going back to, how to handle the stressors, how to handle the anxiety. Did you know that stress and anxiety actually have a physical impact since our adrenal glands, which are the glands that handle stress, will be affected and it'll increase our cortisol levels. And then as we keep using cortisol, we're always in that fight reaction. Then you're going to have something called progesterone sequestration, because everything goes to survival, and reproduction and sex are actually luxuries in a biological term. So if you're always on survival mode, well, your body is not going to be in reproductive mode, okay? So it's extremely important to find ways of healing those wounds, also handling anxiety and stress, um, whether it's through support groups, therapy, yoga, meditation, very, very important. Even being on medication if needed to be, that is really going to support you through not only your fertility journey again, but also your journey through life. Since it's through those challenges that we grow. So either we grow or those challenges could crush us, okay? And I wish upon all of you to have that growth, to have that fulfillment, okay? So, hi to everybody for those that are joining us. For those of you that have never seen me, I am Dr. Verdiales. I am the Atlanta doctor with CNY Fertility and with Restore Health. So, going back to those things, let me just keep going on a few things. It's pretty cool how we can connect through this wonderful internet, no matter where we are, and even through some of the crises that the world's been going through, we are still able to connect. Human beings are gregarious by nature, so we're not designed to be loners. So it's great to at least be able to connect virtually. So a lot of love to all of you from me and from all of CNY. So going back to what else can we do? acupuncture, even acupuncture, getting that chi, that energy, that life force to move in the right direction, support our adrenal glands, which is so, so important through this process. The adrenal glands, like I was mentioning before, are the glands that handle stress. However, they can distinguish between psychological stress, meaning anxiety. You're anxious about your IVF process. You're telling yourself undeserving belief sentences and ideas like, what if I'm not good enough? What if I'm not going to be a good mom or a good dad? What if I fail again? All those things create a very high level of stress. And your adrenal gland is the one that handles that. Are we about to run away from the lion? Or are we about to run away from an IVF cycle that's going to just crush me? It can distinguish between those two things, and it has the same physiologic response. So as we move forward, it's very important to support those glands. And for those of you that have talked to me directly, I use a lot of glandular therapy. The adrenal glands are our main reserve for vitamin C, since they use it so much. So adrenal glands are also involved in immune response because, again, a foreign invader, whether it is bacteria or COVID, it's still a stressor, okay? So we have emotional stressors, we have psychological stressors, we have chemical stressors, infectious, okay, like bacteria and viruses stressors. We have internal stressors from all the metabolic pathways of our everyday use of our bodies. They create gunk, and that becomes to some degree stressors as well. So the adrenal glands are very, very important. But also, on another side, they also balance our thyroid and our gonads, or ovaries, testicles, okay? So if you're stressing them out because of life, then they're going to eventually become fatigued, something called adrenal fatigue, and that's going to inevitably affect the function of the thyroid and the ovaries, since they create some sort of triad. So how to support the adrenal, how to handle that additional stress, that chronic stress in the majority of your cases, because if you have arrived at CNY, you have probably been through this for a long time. You have probably had IVF before, IUI. You've been on a journey very, very long, so you're definitely having some sort of adrenal fatigue. So like I was mentioning, vitamin C, food-based vitamin C. Where can I get that? Kiwis are a very, very good source of vitamin C. Buckwheat is a very good source of vitamin C. Citrus fruits are very famous for being a good source of vitamin C. Or adrenal gland from another animal, another mammal, like a cow adrenals. So some of the pills that I use are actually cow adrenal glands in this journey of fertility, to support the adrenal gland and provide that vitamin C that the adrenal needs, and therefore improving endocrine function. So another way of handling stress would be exercise. And I'm not talking going to the gym for 2 hours. 20 to 30 minutes of aerobic exercise is the equivalent in your brain as 10 milligrams of Prozac. So not only you're getting your natural endorphins to kick in, you're getting some of that stress hormones to get released, cleared out of your system. So sense of well-being, of relaxation, then you sleep better. So then your circadian rhythm is more in sync. So you see how it all comes together to your favor. There's some herbs that can be used to help the adrenal glands, and some of you have been through this fertility journey have used them without knowing exactly how they work. For example, one of my ultimate favorite herbs is called ashwagandha. It's an Indian herb. It is fabulous to bring that cortisol down. It increases naturally testosterone and therefore balances out your hormones. So it's in a lot of the preparations for fertility because it works that way. Increases testosterone, decreases cortisol, supports the adrenal to work better. So it's a very great adaptogen. Another great adaptogen would be licorice root. Licorice root also decreases the cortisol levels, but between the two, I mean, at least in my experience, ashwagandha tends to really kind of have a more marked drop where it makes me sleepy. It makes some people sleepy, while the licorice gives you more of a sharp, relaxed feel, but you're not sleepy. So you're just more sharp, up in your brain. Schisandra is another great herb that could be used to help with energy management, hormone balancing, supports the liver. The liver is so important. Some of the testing that we do through the fertility workup is actually checking your liver. Why? Because the liver is the one that clears your hormones from your system, not only the ones you make yourself, but the ones we're putting in you. Think about the high doses of hormones we're giving you, because what is going to live? What is follistim? It's actually FSH. It is a pituitary-based hormone to recruit follicles. What is menopur? It's FSH-LH, which are also usually pituitary hormones to recruit and mature your follicles. In the case of women, they are also present in men in a very similar function, but I'm not going to go into those details since it's mostly the girls that we really hammer with all of this very high level of hormones. So the liver needs to be supported as well, so it doesn't get, choked essentially with all of these hormones coming in, and then the ones you make yourself, and it has to process all of that. So Schisandra is a great herb, not only to help the adrenal, but also to support that liver through those processes. And then none of those that I have mentioned, and I'm very specific with some of you as we discuss your fertility journey, that I don't really like you guys to go on herbs during the IVF process because it can affect the results that you're seeking, since there's really nothing normal about IVF. So, and a lot of herbs will be pushing through a normal ovulation process, and we are hyperstimulating you. So again, there's really nothing normal about IVF or nothing natural about it. So I really tell people to stay away from herbs, especially if you don't really know how to mix them. But licorice root, ashwagandha, and Schisandra would actually support your IVF process and not really interfere with the medications that we usually use. But unless you are working with a very versed naturopath, I would just eliminate all sorts of herbs. So just to recap, before we go into your questions, psychological and emotional, mental challenges through a fertility journey, those need to be addressed, including your non-serving, deep-seated belief system that could be blocking that miracle rainbow baby from happening. So I went over the adrenal gland and the liver and your sleep cycle, which is extremely important. Gland therapy for the adrenal. There is gland therapy for the liver, and sometimes supporting those two organs could be a deal breaker for overall health, but also some of the herbs that could also support those those organs through this process. And then before I move on to your questions, um, there's also some methods to reprogram your subconscious and try to dig in, you know, very, very deep seated beliefs that are non-serving, like you're not good enough, or I'm not suited to do this, even though on a conscious level you want to be a parent. Maybe at a subconscious level you think you're not either worthy or good enough, or you doubt that you'll be able to be a good parent. So we need to clear all of that. Any deep-seated anger, reproduction is a process of love. So you have to start by loving you, accepting you, believing in you, such that you can manifest that rainbow baby. Alrighty? Well, very good. Again, I'm Dr. V. For those of you that just joined us, let's go through some of your questions before we head out. How do I feel about genetic testing? I think that the parents should be genetic tested. It will give you a lot of information about yourself, not only for fertility, but even for the future. I'll give you an example. I was blessed and I was able to come across genetic testing for myself a few years ago from a nutrition standpoint, and I got to have a lot of information. For example, I figured out I was an MTHFR gene mutation carrier, and I thought, oh, that explains, or the cardiac disease in my family, and that helps me prepare for my own future, being very attentive. I know I need to eat a lot more greens and folic acid because I don't convert to folate, so I can prevent a heart attack in the future. So genetic testing gives you a lot of information for you, but also in this particular scenario for your fertility journey. In terms of the embryos, I have mixed feelings about it. One, it can damage the embryos. And I see more and more that having normal embryos does not guarantee a pregnancy at all. It's almost like, I'm sorry, there are bugs everywhere. It's almost like, I don't see much of a benefit. I see a lot of failed transfer with normal embryos, and then you always wonder, is it because of the biopsy? Because then you are altering the outside. Are you, as you're taking the biopsy, are you causing issues with receptors? We don't know, okay? And then to be fair, this is the best technology we have so far. I can understand for certain situations, it's all about risk and benefit. If you are in your 40s and you really want to check to make sure you have a normal embryo, I can see the benefit, outweighing the risk. If you know you are a carrier for a lethal genetic condition, I can see the benefit outweighing the risk. But just because, I just don't see it. So that's my opinion on it. How do I feel about LIT? Yes, I am all about LIT. So it's, what is it? Leukocyte. I know what it is. I just can't go through the acronym right now. Unfortunately, it's illegal in the United States. You would have to travel to Canada to get it done. We're super excited at CNY about it, but we can't do it in any of the USA offices, but the Montreal office is doing it. So is there a weight limit for IVF embryo transfer? No, there's not. However, the healthier you are, the better chances of success. And I have seen where 5 to 10 pounds, of less weight could be the deal breaker. So as you are going through this IVF process, we're not going to put any limits on you. But if you get healthier, as you get healthier, the weight is just going to come out. I would encourage you to do so. Hi, Stephanie. I hope you're doing awesome. Hello, everyone. Yes, I am in my beautiful island, and I am, like I was saying, I'm in a little island called Vieques. My grandpa It's actually from Vieques. So there is a tiny K in Vieques called Verdiales. So, you know, it's kind of exciting. All right. I had an IVF transfer of high-grade embryos, lost at 8 weeks, but kept measuring 5 weeks. So, what happens with great embryos that are lost? There's so many factors, including the unknown. Could it have been a vaginal infection? Yes, infection will cause miscarriage. So it would be great to kind of regroup and see what happened. However, if at 8 weeks your pregnancy kept measuring at 5 weeks, you probably lost it about there. So even though you lost it at 8 weeks, it really just stopped developing at 5. But it would be worth to kind of look at everything. And if you did develop a vaginal infection, especially bacteria, then we really need to look into that and maybe do a DNC endoscratch hysteroscopy with prolonged antibiotic use and probiotic use. Hi, Cindy. Thank you for your kind comment. We're here to serve. Do I think stress inhibit fertility? Hell yes. I can attest to that as a fact. When I was trying to get pregnant with my first child, I was on a mission, and talk about temperature charts and ovulation kits. It was the month I just got sick of it that I got pregnant. Stress in your body, like I was mentioning earlier, will have a physiologic effect. It will alter your hormones. It will increase cortisol and epinephrine levels, increase your sympathetic versus the parasympathetic nervous system in an abnormal ratio, and on prolonged chronic stress will mess up your progesterone use because of something called progesterone sequestration. And then down the road, you have adrenal fatigue, and it's a slippery slope, messes up your thyroid. I mean, yes, stress inhibits fertility, and that was kind of the underlying message for our subject of the day. And I am wondering if my worries are causing a cycle to fail. Probably yes. They might not be the entirety of the story, but they definitely tilts it not in your favor. It would be great to have a more detailed discussion, Lauren, on how to help you, including doing a few meditation visualization processes that I can teach you. I can give you some homework. I like a technique called Psyche to release some of the non-serving beliefs. So definitely message me through Messenger, Mary Bell Verdiales, MD, and we'll get you in to have a discussion more in depth. I had a transfer late June with a 5AA and a 4BC. What can I do next to transfer to make it stick? Any suggestions? I love PRP, especially if you do some uterine priming with the right supplements, Utrophin, vitamin E, food-based. I use a company called Standard Process, Nutritional Frontiers. I use ancestral supplements as well. So yes, so prime that uterus, work on your overall health and priming of that uterus to improve results. And then you can do some of the washes if you didn't do it the first time. You know, the ACG wash, the baby glue right before transfer. You know, make sure you are on an immune protocol if you have not, and if you were on a very mild, maybe just crank it up a little bit. like our other friend, are we dealing with a chronic infection that was missed? Just just go over all of the list to see what else can be done to improve outcome. Okay, definitely you can message me through Messenger, Maribel Verdiales, via in Victory, and we can go through your particular case. I am not sure if I have PCOS. My AMH is 6. My FSH is 8.7. AMH of 6, it's on the higher side, not high enough to go crazy. If you are having regular cycles, you probably don't have PCOS. And then your FSH is 8.7, LH 6.8. It's not in a perfect ratio, but the FSH is higher. It's usually a 2-to-1 ratio. Hello, hello. Okay, so Natalie graduated from CNY. God bless you and congratulations. I've been dealing with anxiety since I got used to the weekly monitoring in CNY and dealing with the idea of waiting a month for my next appointment. So you're dealing with the fact that you have your miracle pregnancy and you're stressed out from losing it. That's completely understandable. We can definitely talk about it and work through those anxiety. You have to work through this as you move forward, okay? Accept that blessing. You have to accept it, okay? At CNY, even though I know that we graduate you guys at usually about 10 weeks to 12 weeks, you can still come see us. Even if if it makes you feel better, just pay your ultrasounds out of pocket. Down the road, you can get a machine to listen to the baby. So regular OBGYN care, yes, it's monthly, especially the first few months, and it could be stressful coming from a fertility world where you're with us every other day. So it will take some adjustment, but again, we can definitely discuss on how to handle the stress. Just message me and we'll get you on the schedule for this. I do see patients outside of fertility for all sorts of things. For those of you that know me from before, I am a naturopath. I still do GYN. I'm the only one that's still doing GYN within CNY. It's more like women's health because I handle all these different things. So I can give you a few pointers to help you through this transition, Natalie. Okay, so I have been through IVF for 3 years. My meds haven't really changed. My last cycle, 10 follicles, 5 and 1 fertilized. I just tested negative at my 2 weeks. Nope. I mean, if you are getting 10 follicles, we just have to, 1, tweak your protocol. So if you're getting a ratio of 10 to 1, there's something wrong somewhere that needs to be addressed. And we probably should do some priming. I believe everybody should do some sort of priming to improve outcomes. So priming for me, so the Verdiales idea of priming would be change your diet, just like Dr. Kill says on his videos. Get an organic prenatal. Get the right supplements, get some glandular therapy. I usually will recommend something called a female endocrine pack because it's a very good overall support for your endocrine system. CoQ10, vitamin D, inositol, especially if there's any questions about PCOS. A good source of vitamin E. Vitamin E food-based, not tocopherol, not the alpha tocopherol. It's excellent to have the quality of your egg improved by supporting DNA division. So getting all of that on board 2 to 3 months before, and then do PRP every 3 to 4 weeks could be life-changing. Then I usually will add Omnitrope and LBN in that priming process as well. And then tweaking your protocol to serve you better, Miss Bregan. Yes, I love intralipids. I sometimes will even throw in intralipids on priming, during priming, especially if there's an autoimmune suspicion or inflammation question. Okay, so and then intralipids for stimulation and then for transfer. Absolutely. Oh, that definitely, Lauren. So if you work as a PA in a trauma center and then you're handling fertility challenges, girl, you need to kind of really address all of these. So just reach out to me and we can talk about how to help you. So level 4 of autoimmune protocol. You can definitely start by on layers. Depending, you know, you can start instead of doing it all. You can add one and then see how you respond, and then add the other. I am from the believer of less could be more. So if you're in Humira, then we might not need to do the IVIG. I have seen great results of IVIG with people with like the natural killer cells and high antibodies, even if they use it short term at first. I have also seen great responses of autoimmunity with gland therapy. So if your thyroid antibodies are elevated, then you should consider doing thyroid gland therapy to bring some of those antibodies down as well. So you're welcome to text me and I can give you a few more pointers. Um, so an AMH of 0.76, it's bad, but we've definitely seen it a lot worse be successful. So what does an AMH imply? The AMH gives us an idea of how many eggs are we be able to recruit. With an AMH of less than 1, usually we'll recruit a small amount of eggs. We're talking about 2 to 5 eggs. So I have seen a lot of women being able to do that. Also, these numbers are not like set on stone. They all vary. Your FSA changes. Your AMH can change as well. So it's, all those things kind of go up and down, even from 1 month to the other, depending on the overall situation and health and so forth. All right, everyone. Well, I'm sitting outside and the bugs are killing me. So, as usual, many, many blessings. I'm going to write my name down. You can message me. I am not in the country right now, like I was explaining. But you can still message me and remind me on Monday, next Monday, and I will look through your charts if you're a CNY fertility patient, or if you want to become one, I will make sure I can forward that information to one of our staff members to get you in the books. May you all be blessed. Again, look for ways of internal healing. Look for ways of channeling those high levels of stress. Stress kills. It doesn't serve you. It causes not only decreased fertility, but also accelerated aging, hair loss. Geez, I mean, I can go through the whole thing. Go for the walk, be in nature, do some grounding, move. We are designed to move. So go for walks and not necessarily, going kickboxing, but get that blood flowing. And before we get to antidepressants, there are herbs that can definitely help you. Even niacin, for example, a B vitamin could be life changing. All right. So may you all be blessed. I I'm going to try to do our Facebook Live in Spanish on Thursday. Otherwise, I will see you back next Tuesday at 9 p.m. Eastern Standard Time. Have a great rest of your week. Bye-bye.